Again, South Africa's death toll shot up by 128 in the past 24 hours, the highest number reported in a single day. The death toll now stands at 2,657. Nearly 7,000 new COVID-19 cases have been reported, taking the toll to more than 150,000. More than 73,000 people have already recovered, nearly 49% of those who were infected. 52 deaths were reported in the Western Cape, 36 in Gauteng, 25 in the Eastern Cape, 11 in KwaZulu-Natal and 4 in Mpumalanga. Data shows that 92% of those who died since the start of the outbreak were older than 40. Well, Gauteng is the province battling chilly temperatures, not just Gauteng, but the country. My colleague Nqobile Madlala is out and about checking on the state of quarantine sites, and she joins us from Midrand, and you're standing by to be in conversation with the EMS. It's over to you, Nqobile.
Thank you very much, Dudu. Well, after having had a walkabout around these COVID areas, we do understand that everything starts at the point where we are. These are the call centers where people talk to the people around them, around us, and these people then attend to their calls. But joining me now is JP, who is the communications for the call center. Would you kind of explain to us the very details of what do you do in this call center?
So this call center we're standing in currently is the contact tracing call center. And basically what happens is when you go for a test, you fill in a form, you fill in your personal details, your address, and then all your possible contacts. You then do your test, and then once your test results comes back positive, it gets sent to this call center for coordination. They will contact you, and they will also contact your contacts to inform them that you are a COVID positive case, and they will give you some advice on your isolation. Can you self-isolate at home? Do you need medical treatment? And then they'll just give you general tips. From here, then after that, it also then gets disseminated to the districts, where the districts then the district health teams then handles your case until you get discharged, probably after 14 days or after you don't have any more symptoms.
So how has changing levels from level 4 down to 3, alert level 3, how has that changed your working environment?
So I just had a look at our call volumes for the emergency medical services specifically as well. And if the last normal month we had was in March, then we had the lockdown level 5. In April, our call volumes came right down, especially on our trauma. So motor vehicle accidents, assaults, stabbings, gunshots came right down. Then level 4 was lifted. We had level 5 was lifted. Good, level 4 it increased slightly, but not too bad. And then we entered level 3, where everything went back to normal. So currently, under the level 3 lockdown, we have exactly the same call volumes as if there was no lockdown.
We do understand that we are preparing for a peak. What does that mean for you?
It means a lot more cases that we have to deal with as emergency medical service, as well as the health system. So hospital beds availability, ambulance availability. So from our side as the emergency call center, we've created another 68 seats. They're all unoccupied currently. We are going to fast-track appointments of call center agents. We're going to have some contract workers and also increase our overtime budget to make sure that we keep up with the increase in the foreseeable call volumes here.
Well, we do understand that also this affects the EMS side of things. Perhaps explain to us, do you have enough ambulances? And after you have attended to people who have COVID-19, how do you clean the ambulances?
Thank you. I think, we have sufficient ambulance. I think in Gauteng, in terms of the 3 metros and also the 2 districts, we run daily operations. We're running at about 220 to 250 ambulances. Ambulances rotate every 12 hours. So after every COVID case, the ambulance immediately, we have a standard operating procedure that the ambulance gets disinfectant, and within an hour afterwards, it's either fogged or zapped, and then it's been back into circulation. But also ambulances that work day don't necessarily work the night again. They have a rest. So we have sufficient numbers for breakdowns as well in terms of ambulances. And also we have strict protocols for the staff in terms of training, their personal protection, what they must wear, and how to screen themselves. We screen them daily at the stations when they arrive to ensure that they don't have no symptoms of COVID. If they do, then immediately they're not allowed to work for that day, and they're sent for testing.
And how are you preparing for the peak?
I think in operations, how we're preparing for the peak is we've Obviously, we take care of our human resources. We've put them through employee wellness programs, but also we've made contingency that we're putting in an advert for contract workers. We're going to bring in sessional workers to come in when those peak does arise, those specific days that we don't have sufficient resources, so that our operational capacity doesn't decrease in any way.
Thank you very much, sir. Well, as you can hear there, basically the province preparing for the peak, and like he said, from the EMS side, more manpower needed, but definitely something they're on top of.
Thank you very much, Nqobile Madlala. Let's take you